Good morning. I'm News Director Jenna Clay, and joining me for today's People and Perspectives is Carrie Perry. She's the founder of Sam's Spoons, which is about Lyme disease. So thank you for joining us.
I'm so happy to be back with you, Jenna. I always appreciate when you open up a conversation with me about ticks.
That's kind of our thing these days, I guess.
It is. It is.
And we have talked to you before about Lyme disease, but I think this year is obviously very different. I know I've seen people on Facebook that I know are not really outdoorsy people finally taking their families outside, which is great, but I'm not really sure they know about ticks like they should. So what do we tell them?
Yeah, that's such a great point. People are getting outside. And anytime I talk about Lyme and ticks, I always say, go outside. People still need to get outside. You can't be fearful. But people just need to understand that ticks aren't, you don't get them from just walking out on a big hike or something. They're in your backyard. They're in your backyard because of mice. If you have any deer, there's birds. So people do need to be very careful. If they have pets, they need to be even more mindful. And there are prevention strategies too. So there's ways to curtail getting bitten by a tick.
So what should we know if we are heading out? Like, how do we prevent getting a tick in the first place?
Right. So you just want to know that most likely wherever you are, even if you're indoors, you run the possibility of finding a tick. Ticks do find their way inside. So I am a huge fan of permethrin, and permethrin is basically based from the chrysanthemum plant, and ticks cannot handle it. It renders them completely paralyzed. So if you think about it, you're walking around, your children are playing around outside. Ticks go from the feet up. So you want to make sure that you put permethrin on shoes, socks, anything that is a clothing, a fabric, even a bag. If you're picnicking or going somewhere, put it on blankets and, put it on the things that the ticks are going to gravitate towards. So that's a big thing. Second of all, you want to make sure that you put on a repellent. And there are a lot of different types of repellents. There's one that's long lasting. I love, once again, Sawyer products. And any of them that have DEET are fine, but people who are incredibly sensitive can use more like an organic spray. Even oils are good too, but you want to just check and make sure they'll be good for your body and your sensitivities. But that is really important to layer with something that's on your skin. And then you want to make sure that you do tick checks regularly. And you got to look in. My buddy Dan, Tick Man Dan, always says check your crevices, but they want to be in your crevices. And kids are playing around a lot, and people are, squatting to garden and things. So folks, I have to say it, Jenna, it has to be said. You need to check them. And then there's great solutions for proper tick removal. One I love is Ticky's Tweezers because it's got a friendly side for your pets and one for humans. But the big thing is you want to pinch right at the skin and the head of the tick and pull straight up. It's that simple. Don't coax it out with oils, matches. Don't twist it out. You'll anger the tick. And then go to ticklab.org. ticklab.org. This is East Stroudsburg, Pennsylvania, has this incredible tick lab, and it's free for Pennsylvanians. So put the tick in a baggie, or you can go on the website, you can figure out exactly what they want you to do, but put the tick in a baggie, you send it off in just a few days. You are going to know if your tick is sick, most likely before you present with any symptoms.
And we should be checking, like you said, our animals as well.
Absolutely. We're cuddling up to our animals. I mean, let's face it. One thing quarantine taught us is that we can't live without our animals. If we have them at home, they are in our grill and they're probably waiting for us to get the heck out of the house. But that means that they're outside too. And if you're not you can put permethrin on your animals. You can go to Sawyer.com and you can check out the safe ways to do that. You can also use any of the things that your vet will suggest. But you want to make sure you protect your animals because they're snuggling up next to you. And once again, check them for ticks every single day, and proper tick removal, the same for your animals.
So what are some of the symptoms if you think you might have Lyme disease?
Yeah, so the most immediate symptoms can be a presentation of what they call the bullseye rash. It doesn't have to be a bullseye rash. It can be any kind of rash. Typically, it's not hot, but some of them can be a warmer rash. But please, people, you have to understand that is such a misnomer that everybody gets a rash. My daughter did not get the bullseye rash. Actually, none of my children got it. So the other thing you want to look for is maybe a stiff neck and a really, really bad headache and a fever. And this may only last for 3 days. But then after that, you have aches and pains. You just feel general malaise. Your joints are really hurting you. Maybe you're more forgetful than usual. These are symptoms that can become like a neurological component to Lyme disease.
And how do you get tested for it?
So CDC guidelines, they want you to wait to make sure it's like 6 to 8 weeks outside of getting bitten by a tick. And that's because that's when our body starts making the antibodies, and that's when you can check. However, that's tough too, because there are a lot of false negatives, which again happened to my daughter. So check with your doctor and make sure that if they're going to put you on an antibiotic, they understand that when you do get checked and you've already had an antibiotic in you, you might not get a good result. I always say that if you're not real sure about what the CDC result is, try to find a practitioner that's going to really look at your symptoms and listen to you. And that's the best route. Sometimes you need to kind of move from doctor to doctor because they don't all follow that same protocol of the symptoms for Lyme.
And some of those symptoms are similar to COVID-19 symptoms, right?
Yeah, how about it? I mean, 2020 is awesome.
Yeah, woo!
Wait a second, go outside. Yeah, you can go in your yard now. But now you're going to get bit by a tick. And
Right.
wait a minute, there's like symptoms that are similar. There really are. A lot of people talk about shortness of breath when it comes to Lyme, because you can actually have inflammation in your chest. You can have actually Lyme carditis. So those are very extreme cases, but they can happen. You can have fevers, general malaise. There are a lot of overlaps with COVID and Lyme. So if you feel like you didn't get a positive COVID, thank goodness, but you still are feeling yucky, you need to go and get tested for Lyme. It's such a bizarre overlap right now. It's got to be really frustrating for practitioners and for patients alike, but you do need to double up with that other test.
And dealing with Lyme disease is a struggle. I mean, let's talk about your daughter quickly. This is why Sam Spoons is in existence, is because, she got Lyme disease and your whole family was affected. Can you talk a little bit about that?
Sure, absolutely. When someone in your family is sick, the whole family gets sick. I mean, you gather around that person, you rally around that person. In the case of Lyme disease, it is really tough because there's just not enough cohesive information where all doctors are on the same page, whether that's infectious disease or your general practitioner. Testing is really archaic still. So it's hard. In the case of our daughter, she was sick for quite a while until they diagnosed her. What happens with that is now you have like a multi-system issue in your body. It's kind of everywhere. So you're trying to figure out what you can calm down. And it's not always a fix with antibiotics. So sure, you're going to get your 30 days of antibiotics covered from insurance, but if you're going to move past that, good luck. You're going to have to pay for it. We did. And beyond that, there's a lot of different types of treatments that aren't recognized. Those are out of pocket. So in the course of about 8 months, when we were really hardcore treating Sam, it was $25,000 out of our pocket.
Wow.
It's a lot of dollars.
Yeah, that's insane.
Yeah, it is. So there's my Hazel.
Welcome to Zoom interviews.
Yes, I know. What used to not be acceptable is like, whatever. I've pants on. We're good.
Oh, that's good to know.
Bonus. Yeah. So, but one of the things that we wanted to focus on with Sam Spoons is not only providing education to people, PA Lyme does also a really great job with that, but we really want to give to people who can't afford. So we do have a big foundation fundraising component where we want to make sure that we get applicants in that are really in a desperate need, and they just need that thing to get them unstuck. And that thing usually is money to go somewhere where it's out of pocket expenses. And so last year we were able to give out 6 different scholarships, and it's young and old. So we were thrilled in our first year of Sam Spoons to be able to do that. And actually this year we're going to be able to do the same, even with COVID and things coming to a screeching halt. We had done enough fundraising on the front end that still at the end of 2020, we'll be able to open up applications later in October of this year.
That's amazing. I was going to ask about how fundraising would be affected this year, but now is it going to carry over into next year?
Well, that's the thing we're starting to talk about. I mean, we recognize that people have lost their jobs. Their number one priority is to get out and work. Well, imagine a person who is sick. They can't get out and work. And even if they wanted to get out and work, maybe their job doesn't exist anymore. So people in the nonprofit sector are really struggling. We are, and I know others are, in trying to figure out how we raise money. We're talking about it because we need to come up with something that feels good for us to be able to ask folks to give out of their wallet when it might be tough. So the answer to your question is I'm not entirely sure, but we just did a really good job in 2019 to tee up 2020. And so right now we're just sort of being patient to wait and see what's going to be best. We don't know what fall is going to hold. We usually have wine with a splash of lime is our very big fundraiser. And I doubt in September that we're going to be in a place where we can have the 150 people around us like we did last year.
I mean, I don't want to speak for everyone, but I'll certainly get on Zoom and have wine with you, you know.
Yay! And you never know. And we're talking about things like that because those are the fun components to, and again, positives to some of the things coming out of COVID, how we're pivoting. But we'll see. We'll see what happens. We know folks will definitely need that money. So we're trying to figure out how to fundraise.
And we talked about your daughter and how, you know, dealing with Lyme can be an overwhelming thing for the entire family. What's on the horizon for Lyme disease? Are there treatments? I mean, what does it look like?
Yeah, we're slowly crawling there. We really are. Right now in Pennsylvania, we need a House bill to be pushed through because that's really going to help folks who need more than 30 days of antibiotics. They need it covered. And so we're really working hard to get that. So anybody who sees anything on legislature that's about to be passed, whether going to Sam Spoon's, any of our social media pages, PA Lyme, any of those, jump on the bandwagon and contact your senators. We need that bill passed. But the other thing is that there are definitely strides. There are some incredible doctors and researchers out there who are actively and aggressively looking for treatments that aren't just antibiotic treatments. It's hard. Again, it takes funding. And we don't get a lot of funding in the Lyme world. So we work really, really hard doing it. But I would say, I think there's much more awareness now. I love that our Department of Health, Dr. Levine, made some really fantastic comments while she was talking about COVID. She interjected Lyme disease symptoms, what to look for. That type of awareness is huge and paramount. So I think that now that we've had a broader conversation, folks like you who are having me come on and talk about it is really big. And yes, I do think that we're going to get somewhere sooner than later on better treatments and more importantly, better diagnostics.
And give us those websites again.
So you want to look at samspoons.org. That's us. And we're going to show you some really good links to either books or some of the different resources that I have talked about before when it comes to prevention. But we'll also be able to let you know when you're going to be able to go to the applications for the funding. PALyme.org. PA Lyme is fantastic, excellent resources. And basically with those two, those are the good go-tos. But if you're having a lot of issues and you need to find a doctor that's not your general care practitioner, or someone that's more maybe functional medicine, ILADS, ILADS, ILADS.org. It's an acronym, but basically it houses all of the Lyme literate doctors. You can punch in how close you want that doctor to be to you, and they'll give you what doctors are around. You can contact them.
And also ticklab.org, and that's where we want to send the tick away.
Ticks.
Is that what happens?
Yes. Ticklab.org is free tick testing. Please take advantage of it. If you have your tweezers around, I always put mine in a baggie because if I have to pull my tweezers out, chances are it's because I got to pull a tick off and put it in the baggie. So ticklab.org is where you want to go. Yeah.
Great. Is there anything else that you want to talk about that we haven't already covered? I mean, you've done a great job.
I feel like I covered a lot. I don't like to overwhelm people. And I just want to tell folks that go outside and be safe about it. It's the same as putting your seatbelt on. It's the same as not wanting to get a sunburn and putting sunscreen on. And the more that we put into practice prevention and using the things like permethrin and repellents, the safer we're going to be. It's simple. It's very simple. So just be proactive when you're going outside and enjoying your life.
Carrie Perry with Sam Spoons, thank you so much for talking with us today. Enjoy the outdoors and do it safely.
Thanks so much, Jenna. Talk to you later.